Now on News 13, your local leader.
Well, if your child is a frequent bedwetter, parents, listen up. They could have a sleep-breathing disorder. To tell us more, Kelsey is joined live in the studio with Dr. Tara Griffin. Good morning, Kelsey.
Hey, Chris, that's right. Dr. Tara Griffin joining us now, an area doctor here in Bay County. Also spoken on CNN before, just spoke recently at Harvard. And we are talking more specifically about sleep-breathing disorders and kind of that link to a variety of problems in children, but specifically bedwetting. Interesting.
Yes. According to the Journal of the American Orthodontic Society, 9 out of 10 kids display at least one symptom of sleep-breathing disorders, and 92% of these symptoms don't self-correct, and 30% get worse as the kids get older. And bedwetting is one of these symptoms. I thought that was crazy until I started treating these patients and seeing that they stop wetting the bed within as little as a few days up to a couple of weeks after getting treatment.
Okay.
These are kids that don't go to sleepovers. They're socially and mentally and
they're embarrassed.
Emotionally. Yes, they get teased at school sometimes. It's an awful thing to have to experience that.
And a sleep-breathing disorder, what is that exactly?
The root cause of this problem is the airway and the oxygen. So when the brain actually signals a drop in oxygen at night when the child is sleeping, what happens is it triggers a fight or flight response. And so the oxygen actually goes from our smaller muscles like our bladder and our urinary tract and goes to our bigger muscles to allow us to run or flee.
Okay.
And so therefore we end up wetting the bed.
Gotcha.
And these kids may not wet the bed though. They may actually have night terrors, they may toss and turn, they may be restless sleepers, and these little ones are going to be the ones that crawl into bed with mom and dad at night.
Right. So this is such a really interesting link, an interesting topic, and you want to treat these kids, and you can.
We can. So what I do is I use a specialized dental appliance that's worn at night while the child sleeps. It helps to allow them to breathe through their nose. It aligns and modifies their airway, straightens their jaw, as well as their teeth, and this fixes the problem.
Perfect.
It's a simple solution.
Now, you actually are going to have a whole presentation for parents next Thursday. Tell us about that.
Yes. Join us for a parent presentation next Thursday night, March 9th at La Quinta Inn and Suites on Thomas Drive at 6:30 p.m. You'll actually get a free consultation for your child in our office, and just, don't let the child suffer for one more day when there's a simple solution to the problem.
Oh, definitely.
Yeah, call our office to reserve your spot.
Alrighty, sounds good. Dr. Griffin, great to meet you.
Yes,
great to
nice
have you in.
you.
We're going to take a quick break. We'll be right back.